when you go into a low resource population, though, like say for example, I know about the charity, obviously Kids OR, and I know they have pediatric surgical sites in Uganda in particular. And some of these places are in rural Uganda. Is that right? Would to say it's outside of Kampala?
Yeah, absolutely.
So what are you dealing with there? I mean, are you able to get appropriate levels of sanitation? Are you able to get decent equipment? What are you doing?
It's really a spectrum. So some of the places I've been, you actually have minimally invasive surgery, laparoscopy. I was teaching some of that in Kenya last year, which was really phenomenal to work with the teams there. Other places you might have very minimal equipment, not the right equipment, not a great opportunity to sterilize equipment, for example. So you're up against a lot of challenges. And I'm sure we'll get into this, but a lot of what we're doing at Kids Operating Room is trying to bridge that gap so that people in rural Uganda don't have to be doing without and can really provide the best, safest care they can to kids around the world.
And what kind of, I mean, like the pediatric operating rooms that you're working in Uganda or in other parts of low resource areas, are they, what kind of surgeries are you seeing? Are they emergency things? Are they?
Both. So there's a lot of emergency operations that are happening. There's a lot of wait lists. Kids here might get a hernia fixed in a couple of weeks. It might take years in a lot of other places. And the impact on a child's life and a family's life, if that's the case, can be really devastating. We also see a lot of complex surgery. So it's amazing. There's so much talent in all of these other places. Uganda is a perfect example where they've been able to separate conjoined twins. And, we think of that as something that's so highly specialized, but the technique is there. The training is there. It's really just the equipment and a little bit of probably solar power, because that's another problem operating in these places, power outages, that can really make a difference.